Good evening, everyone. How is everyone doing? How is your day and how is your evening unfolding? Thank you so much for joining in. This is Dr. Lewis from the Health and Wellness Support. We appreciate you for the support that you've accorded us all through. Thank you so much for also joining in this live. And today, it's a very interesting topic for women. Men are also involved, however, the bigger part of it is for the women. This is recurrent yeast infection in women. Why do you have that yeast infection? What is the difference between that yeast infection and candidiasis? Where does this yeast infection hit you hard? So what is causing it? How do you go around it? How do you treat it? Or how do you manage it? So if my sound is clear, kindly just wave so that I can know how to continue. Latifa Ingabire, thank you so much for joining in. It's a pleasure to have you here. Miriam Kanyuira, good evening, Miriam. We're good, God's grace. So yeah, invite those guys here, invite those ladies here so that we can have this conversation once and for all. Because this is not a topic we can basically teach on the board. It's easier when you talk about it and when you ask those questions on this live, so that at the end of it all, we are done with it and you can know how to handle yourself and change your life for the better. So for those of you who are streaming in, welcome aboard. If you're new here, this is a home of health. If you've been here with us for the longest period of time, or you've been here even for a while, again, welcome back to the health and wellness spot. Now, I will not take too much of your time, and as people stream in, we shall go deeper into it so that we can also give time for people to ask questions regarding this topic. Okay, welcome aboard, Stephen Kimathi. Good evening. Learn something today. That's the name of someone goes by the name Learn Something Today. Yes, so here we are here to learn today. Now, ladies, this video is for you. Now, I want you to understand this, that when you hear something called yeast or candida, candida is actually a type of yeast, and yeast is a type of fungus, or fungi. So in the classification of microorganisms, we have bacteria, we have fungi, we have protozoa, we have viruses, and fungi is part of them. And now yeast is part of that fungal infection, and also candida is a type of yeast infection. So basically, we're just classifying it broadly, but all this is under the fungal infections. However, candida, to be specific, and yeast, to be specific, is there naturally. So it doesn't cause any harm in your vagina, in your mouth, in your gut. It exists even in your armpits. It's a normal flora, for heaven's sake. So don't be scared. Don't be worried about yeast infection so much to think that it's either a toilet infection. It's not. It's a sexually transmitted infection. It's not. Okay, it can be a urinary tract infection on the extremes, but it's not as harmful as we can think about it, because anytime women hear about the yeast infection, it's always in their minds, it's always a negative thing. And men, there are records of men who have left marriages and their women because they have recurrent yeast infection and they didn't understand it. So we are here to correct those myths. So it's a normal flow, right? It's there to actually help you clean the vagina and maintain the pH of your vagina. However, I want you to know that in the vagina or in the body generally, there are two things that go hand in hand, the bacteria and the yeast. So we have good bacteria that actually maintain your vaginal health by actually keeping these yeast microorganisms in check. So these bacteria are not always bad as we think about them. Some of them exist to keep that the Candida albicans has started to multiply excessively. And when it multiplies excessively, that's where the problem comes in, because now it is infectious. It finds a reason to conquer. And that's where your itching starts. That's where, and that itching actually, that's where the discharge becomes intolerable. That's where the smell or the foul smell starts to come in, and you start getting worried. Now understand this, that this yeast infection, or this fungal infection, once this yeast starts to multiply and gets to an overgrowth. So it overgrows the healthy bacteria, and now it starts to cause you the itching. And now that itching will cause cracks on the lips of the vagina. For those of you who have sat in a biology class, know uh, labia majora. So these are the outside lips of the vagina. So once you start scratching yourself, there's these cracks that happen because of change of pH, because of overgrowth of the yeast, because of scratching. So you get those cracks. And now these cracks are the ones that bring you problems, because when you go to urinate, the urine gets into these cracks and starts to itch. That's why you get itching. That's why you get pain during urination. And again, it can be very problematic because once it gets deeper into the vagina, those cracks get near the hole, the orifice, the vaginal orifice. And when you're having intercourse, it becomes so painful because of those cracks. So that is how yeast infection starts. Now, I already told you that yeast infection is not a toilet infection. So those women who keep on saying, I got this by just visiting my friend's toilet, I got this because I tried out a new dress or a new trouser, that is not true. That fungi exists there naturally, and the only thing that you're doing is you're either altering the pH of the vagina, or you're actually killing the good bacteria and exposing yourself at the overgrowth of this yeast. So that is something that you should get clearly. You don't get it from anywhere, it is there. What you do is you suppress your immunity, or you change the pH of the vagina, and then it becomes infectious, and that's how we get the infection. Okay, so take a second to sink that in as we say hi to other people here. I see Kefa Ogwell, I see Eunice Mudhoni, I also see Latifa, or Latifa had mentioned them earlier. So yeah, so that's how yeast infection happens. Now, I want you to get this, that we have this this fungi, we have them in our throat, we have them in our gut, we have them on our skin, we have them in our mouth, and we have them in the vagina. Now, if I told this the yeast was harmful to you, why would they be existing in all these organs? That's why we call them normal flora. They are just there to help you. They help you in digestion. They help you in maintaining the pH of the body and the vagina. They help you in skin function. They help you in even keeping check other microorganisms that are harmful to you. So they're not dangerous. They only get harmful when they overgrow. And how do they overgrow? You make them overgrow. And now this leads us to the causes of yeast infection. So how do we get yeast infection? How do we get infected with these microorganisms? Number one, most of you are used to taking over-the-counter antibiotics. Now you get a common cold, you've not even confirmed it is viral. If it's viral or if it's bacterial, you're running to the pharmacy to take amoxicillin capsules. You're running to the pharmacy to take azithromycin. You're running to the pharmacy to take any antibiotic that is broad spectrum. You cannot know if it's broad or narrow spectrum. That is the role of the pharmacist. However, if you go there, most pharmacies are open, not because they want to help you, but because they want to make profit. So if you go there and you ask them for an over-the-counter antibiotic, of course, I want to make profits, we will dispense it to you. So that's a problem, because this bacteria, this antibiotic will actually destroy, and also H. pylori kits. Most of you are fond of taking those kits all the time because of H. pylori induced ulcers. Yesterday we talked, is it yesterday or the other day? We talked about H. pylori induced ulcers and how it happens, even though the internet wasn't stable as such, but we had that conversation. So this is the point. Those antibiotics will kill both the good bacteria and the bad bacteria. Now, guess what? The function of the good bacteria is to keep bad microorganisms in check. They compete with food, they compete with space, they fight, they compete with nutrients. And therefore, these good bacteria suppress the population of the bad bacteria, or suppress even the population of other good bacteria that, when they overgrow, can be harmful to you. And this is how you suppress the yeast infection. Okay, so Candida exists, and then we have good bacteria, but the population of good bacteria is higher than the Candida, so Candida remains as low as possible and cannot cause you any infection. But if you use that antibiotic, you kill these good bacteria, and therefore you raise the population of the fungi. And then next, we have the itching. Next, we have all the problems that are coming with this. You have the discharge now. And also understand that sometimes you cannot get out that discharge. Sometimes you get this infection, you get the symptoms, but you don't produce any discharge. And this discharge for yeast infection is very, very specific. We have thick, like look like white substances coming out, and then we have that white discharge. So it's very, very specific, and it's easy to diagnose. But we wouldn't want you to diagnose it by yourself. You would rather go to the hospital and get a diagnosis from the laboratory. Okay. So overuse of antibiotics and abuse of antibiotics. I will talk about respiratory tract infections and how people abuse amoxicillin. Nowadays, in Kenya, men and women are abusing antibiotics by using them to chew cat. Cat is what we call miraa in Kenya. So it's a stimulant. They chew it and they use these antibiotics. That is a problem because you're going to get antibiotic resistance. And when you get ill or sick, it will be hard for you to be treated because of resistance. So you are not sensitive to that antibiotic anymore. Number two, you're actually exposing yourself to low immunity, and then you're going to head all into all these other infections like the yeast infection. So do not abuse antibiotics. Only use antibiotics when necessary and when prescribed. Take that. Number two, the obvious one is the diet. The diet. Now we sing about dietary modifications in this channel every day on every condition. We sing about the same dietary modifications. Why do we do that? Because number one, yeast feeds and lives on sugar. So sugar is actually the major food for yeast. On this note, women who wash their vaginas using yogurt, hoping that this yogurt will maintain the pH of the vagina and that it will introduce good bacteria in your vagina. Yogurt is full of sugar, drop it. Ladies who want men to have oral sex with them, they go ahead nowadays to eat pineapples so that when they urinate or their vagina starts to smell like a pineapple. You know these things. I hardly speak about things that are not known. These things, you know them. That you eat pineapples expecting your boyfriend to come over. Now you're eating these pineapples, and this you're hoping that this you're hoping that these pineapples you will get them through the urine so that your vagina smells as a pineapple and your man enjoys licking your perineum. Now you're getting in trouble because pineapples are sugar and that is fructose. That is food for fungal infection. Now, are you wondering why you keep on getting recurrent yeast infection even after eating those pineapples and hoping they are good? So imagine somebody who keeps on eating fruits, eating sugar, eating cakes, drinking alcohol, eating wheat products. You are actually altering your, not only are you altering your immunity, because sugar makes neutrophils, which are basically your immune cells that actually come first in handling all infections. So it makes them sluggish. Once it makes them sluggish, you are unable to fight infections, and yeast infections will be part of you. So you'll not run away from it. You'll not be able to run away from it. So drop those fruits. Drop that pineapple. I don't know who came up with this theory that pineapples will make your vagina smell. By the time you're thinking of eating a pineapple to help or change the odor of the vagina, you're actually eating the wrong foods. Your vagina is smelling bad, not because you did not eat a pineapple. It's smelling bad because you've been eating wrong foods and they are feeding microorganisms that are actually harmful to your vagina and your health in general. So stop doing too much. Then you eat all these pineapples and then that man does not go down on you. How does it feel though? Because now men are being taught stoicism and not going down on women and stuff, and it's all over. We know that. It's all over. Okay? So stop eating sugar, stop feeding yeast infection through sugar. This fungal infection, once they ferment that sugar, they bring now acidic pH, they bring now a different pH in your vagina. They also feed on that and multiply, and they overwhelm the good bacteria that are supposed to protect you. So that becomes a serious problem. Okay? Number three, most Kushite women are guilty on this one. The steroid drugs. Now you apply a lot of steroids on your skin to lighten your skin. Now you use the same steroids like dexamethasone is highly abused for women who want to grow a big buttock and big and wide hips. But you forget that these steroids will actually raise your cortisol levels in the system, and this will raise your blood sugars. That is a problem for you. Number two, These these steroids are actually directly involved in lowering your immunity. And once they lower your immunity, guess what is going to happen? All the normal flora will blow up. You'll get into those boils. You'll have this fungal infection. You'll have all the conditions, all the normal flora that have been suppressed by good bacteria, by your immunity, are now starting to be active and multiply so fast and start causing you harm. You've seen this in people who are HIV positive and who are not embracing dietary modifications as such to boost the immunity. HIV actually kills your immune cells. It doesn't kill you, it kills your immune cells, your army. Once it kills that army, then any other microorganism, be it bacteria, be it virus, be it fungal, be it protozoa, will come up. Be it fungal, will come up. When it comes up, now you start having all these problems. That's why most HIV people will have oral thrush, they will have esophagitis, they will have problems with digestion, and they'll have problems with yeast infection all the time. It's recurrent. Even if you treat with antifungals, but you still eat the same foods, it comes back. So ladies who use dexamethasone to broaden their hips and their buttocks, don't be surprised. Don't even think further. Now you know. You're trying to widen your hips, and then you're weakening your bones because the steroids weaken your bones. So you come back with fractures. You will go for a hip surgery or hip replacement. Now you have a recurrent yeast infection that will cause you problem, including infertility. You can imagine by just taking a medication all through to just impress a man, and then you end up getting all these side effects from those medication. A pharmacist or a farm tech will not tell you that, or a businessman will not tell you that. They'll sell these drugs to you because they want the profits anyway. Number 4, women, women, women. We have always said that stay away from hormonal contraceptives. Hormonal contraceptives are actually messing you up. They are adding you weight. That is actually a problem to you. They are weakening your bones. They are causing you diabetes. They are causing you depression. They are causing you migraines and spotting. And now they are lowering your immunity to expose you to yeast infection. Please stop doing too much. Birth control is in the hands of the man. Let the man wear a condom or let him retain his semen. If he cannot, please don't do too much. Don't go and take a hormonal contraceptive, either a pill, an implant, an injection, a patch, so that you can enjoy unprotected sex for that matter. Sorry. Don't do that because it will lower immunity and you'll get this. Now, also get this. Most hormonal contraceptives are estrogenic in nature. So they have high content of estrogen and low content of progesterone. Most of them are high in estrogen. That is going to expose you to estrogen dominance. We are talking PCOS, we are talking fibroids, we are talking infertility, we are talking cervical cancer and breast cancer, we are talking ovarian cysts, we are all these conditions are coming. We are talking acne, very bad skin because of estrogen dominance. Now we are talking low immunity, so infections are coming in. So why would you do that? Why would you please don't sacrifice too much? Don't. But again, the choice is yours. If you want to recover from this condition, you now know what to do. If you don't want to recover from this condition, continue using that hormonal contraceptive. High estrogen levels is very dangerous to a woman. Remember that this infection most of the times gets pregnant women also. Why? Because of high estrogen. It gets women in their menopause. Why? Because of estrogen dominance. It gets women when they have menses. Why? High estrogen, and therefore immunity goes down. Pregnant women are sharing the immune between them and the child, and again they have a rising amount of estrogen, which basically exposes you to yeast infection. So imagine you're not pregnant and you're using hormonal contraceptives. So you're topping up to estrogen levels, and that is estrogen dominance. So that is the relationship between estrogen and progesterone. We want high progesterone and low estrogen. But when you keep on using hormonal contraceptives, you're eating GMO foods that have been cultivated with fertilizers and herbicides that have glyphosate. You're using perfumes and deodorants that have phthalates and have high estrogen. They disrupt your estrogen levels. You're using now hormonal contraceptives. Imagine that. And then you're eating very bad foods, processed foods that will actually raise your estrogen and insulin. So you're digging your own grave. You are. So you're now wondering, why am I having persistent and consistent and recurrent yeast infection? It's not about the yeast infection, because yeast, you have it naturally. It's about you. What are you eating? How is your lifestyle? Most of you, you wash your undies or your panties, and then you hang them in the bathroom, and then put a towel on top. Sun your undies in the sun. Let them just air them outside in the sun. Let them have that heat. Let them dry up properly. Most of you are using uh, these tampons, which have content of estrogen in them, because you want to go swimming when you're having your menses. Like, the swimming cannot wait, so you have to use a tampon. And you started earlier, because in your childhood, your setup, you started using the pampers, and then as you grow up, now you're introduced to tampons and stuff, and you're getting into all these problems. I know most of you don't even know the ingredients in a tampon. Some of these chemicals that you're using to lighten your skin, very dangerous to you, toxic to the liver, toxic to the kidneys, and now they have high estrogen again. Those perfumes, those vaginal douches that you use to wash your vagina with. So we are at number 4, I think. Number 5, infections and diseases, HIV, cancer. These are conditions that when you have them, they fight your immunity, they lower your immunity, and then now the yeast infection comes up. So when you're handling this topic, you are only talking about 3 things. Number 1 is the pH of the vagina. So anything that changes the pH, because the pH is supposed to be slightly acidic. So anything that changes that pH towards basic is a problem. Number 2, we are talking about estrogen dominance. So anything that raises your estrogen, problems. Number 3, we are talking about the bacteria, good bacteria. So anything that lowers the good bacteria, problem. And now we're talking about dietary modifications and hormonal contraceptives. So HIV, cancer, these are conditions that will actually exacerbate or expose you to getting these infections. And maybe last but not least, drugs. And steroid drugs are falling in that bracket. Hormonal contraceptives are falling in that bracket. Again, before I forget, diabetes. That is part of the diseases. Diabetes, women who are diabetic can never lack fungal infection and yeast infection. They can't, because they actually provided food or the culture for growth of these microorganisms. Okay. So let's go. Let's check out some people again. Kefa Ogwell, welcome aboard. Thank you so much for being here. I think today my sound is a little okay, so I don't see them complaining a lot. Okay. Listen to this question. I'm a medical student, and actually, you've changed my perception of medicine. Thank you, sir. This is who? This is learning something today. We mentioned him in the beginning of this live. So I'm glad we are changing lives. And bro, be careful, because if you exercise what I preach most times, and you're still a student, you will intimidate your lecturers, and they might end up victimizing you. So you'll fail. So you have this information deep in you, let it boil, let it ferment, let it get better, and then use the syllabus, understand also the syllabus, so that as you get out and get your qualification, because that is what they want you to qualify. After you are qualified, now you can use the information that has been fermenting inside you to question the same syllabus. So you're doing good. Keep going, bro. We need a generation of students and interns that are coming out that can easily challenge the status quo, and that have the information, and that use their education to change lives, not use their education to just regurgitate the same. So we appreciate you and we celebrate you, and I'm glad that you're on this platform. Kefa Ogwell, why do pregnant women suffer candida infection? Most of them, you will see milky discharge when you do vaginal examination. Good question. I think I've answered that question adequately. Number 1, pregnancy can lower your immunity because you're sharing immunity with your child. Number 2, pregnancy exposes you to high estrogen levels, and high estrogen levels lowers your immunity. So you get your yeast infection coming up. Okay? So that's the point. And number 3, pregnant women are eating so much crappy foods. They eat a lot of sugar, they crave a lot of sugar, which is a false craving. Progesterone only exposes your false eating habits. So pregnant women get this because of those factors, and it's all about the estrogen that is rising. So it's coming from diet, it's coming from also hygiene, because most pregnant women become lazy, and they don't perform good hygiene. And on that lazy part, you can get yeast infection by being too clean also. Women who want to wash their vaginas with soap so that it gets clean. Women who want to douche, those vaginal douches, those vaginal perfumes. I already talked about the pineapples, and those women who want to use yogurt. So all these are factors that are actually contributing to yeast infection, even in pregnant women. Okay? You are talking about my problem today. Tumukunde. I'm glad that finally we have reached to your concern. Munira, good evening, Doc. I like all your videos because you're so informative. May God keep you safe and sound. That's a blessing. And by the way, your blessings are the ones that are keeping me going. We set a target at the beginning of, at the end of last year, that by the end of this year, we will get to 20,000 subscribers on YouTube. And we've done that. Not because we are the best doctors in town, no. Because you people trust our information, you people have tried it and it's working for you, and you've trusted us, and we never disappoint. Do you know it? If you've tried it, we never disappoint. And once you just see the results, imagine somebody losing weight in about a month and you've lost about 4 kgs. The motivation that comes with that is enough to keep you going. That is what you need. And now guess what? And most of you, in the beginning, when you get in contact with my videos, even on TikTok, you get so upset because I tell you what you don't want to hear. And I tell you what the syllabus did not tell you if you're a doctor. So I tell you things that you've never heard, because you've been so brainwashed with the syllabus and you've been so conditioned with your doctor to think in a certain direction. So once I change that and you try it, because you become bitter in the beginning, you don't want to listen to me, but once you hit with the disease, you don't have an option. So you come back slowly. Now, when you come back, I correct you, I show you the way, and you follow that way. And then the results just come in, and you become a loyal follower to our content, and we celebrate you. We celebrate you. We'll do that on our Facebook page, which is Lewis Muchile. We'll do that on my Instagram page, Dr. Lewis Muchile. We'll do that on my WhatsApp. We'll do that on my Telegram channel, which is Health and Wellness Sport. We'll do that on my YouTube channel, which is Health and Wellness Sport. So if you're here and you've not considered even subscribing, you're doing the wrong thing. If you've not considered even liking this video, you're being mean. Don't be mean with this information. Okay? This is information that will change your life for good, and you can't get it that often as you would have wanted to. Okay? Good. Is there any other question before I proceed? I took a lot of antibiotics, now I'm suffering, but don't worry. It's not the end of when you take those antibiotics, it's not because it's not your fault, it's because the system set you up for failure. So it's time to undo that. Simply just drop those antibiotics, start fasting. We'll talk actually how to heal this infection. So don't worry. What can I do to terminate infections on my teeth, especially hapa juu kwa vidole? You said on my feet, sorry. I read that as teeth. What? On my feet, especially hapa juu kwa vidole. We'll talk about that as we terminate this, as we talk about the treatment. Halima Hussein in the building. Martin Miner, thank you so much for that question. Dennis Bolanos, just a tip, doctor. If your Wi-Fi signal is unstable, I recommend using powerline adapters. These carry your broadcast signal using your home's electric wiring. Now, these are the type of people that we want to join us. Thank you so much, Dennis Bolanos. We have noted that, and it is in consideration. Thank you so much, because at the end of the day, it's not about me, it's about us. We want to build a team, we want to build a nation, we want to build a world that is open-minded, that is willing to always change things, that is willing to help a brother to grow. So thank you for that, and that is highly appreciated. So now, we cannot talk about all this and not talk about how to treat it. Actually, number one on the list of treatment, you already know, drop what you've been eating. Number one being sugar, number two being seed oils, three being wheat products and processed foods. Those are the three things that you drop fast before you even think about any other thing. Once you drop those three, you're already at 40% of your healing process. Simply drop sugar in all forms, including fruits and honey, including those poison apples. including that yogurt. If you see anything that is written on 100% natural or pure or organic, as specifically in the in the in our continent like Africa, if you see something written on organic, you should start running away, because I don't think they need to tell you that this is organic. Nobody needs to tell you that sweet potatoes are okay. That's why they're not advertised. Nobody needs to tell you that egg yolks are perfect, that beef liver, grass-fed beef liver is healthy. It will never be labeled. But once they label that tin and it has all those nutrients, or that the nutritional label is very, very misguiding and misleading. The lesser the ingredients in that product, the better it is. The more the ingredient, the easier it should be for you to just throw it away and say, thank you so much. I don't need these nutrients. Okay? So drop sugar in all forms, drop seed oils, start cooking using ghee, butter, tallow, and those animal fats. You can also use coconut oil. Use olive oil to top dress your salads. Don't use it to cook. Use it to top dress your salads. Now you're already on the right track. Number 2, run away from over-the-counter antibiotics and misuse and abuse of antibiotics. Do not. Number 3, no hormonal contraceptives. Either the man wears a condom, or you can, on the extremes, you can use the copper T, the copper IUCD. Even though you'll have some cramping here and some infections here and there, it's better off than hormonal contraceptives. Don't fall for that agenda of those organizations. Don't. On the list of drugs, again, drop the steroids. Don't use any steroid drug to boost or to enlarge your hips and your buttocks. Women, don't. Run away from anything that has estrogen. If you have HIV, if you have diabetes, start reversing diabetes by fasting and healthy keto and working out. If you have HIV, start dropping the viral load by boosting your immunity. And how do you do that? Fasting is very key. Dropping those inflammatory foods is very key. Drinking water and rehydrating water that has salt is very key. Working out is key. Sleeping is key. Enjoying and basking in the sun is very key. It is not as hard as nutrition is not as hard as you people think it is. It's not. And you don't need to go into a nutrition class to understand this. You only need the basics. Experiment with your own body and see what happens. Okay? So, once you've dropped those foods, now this is what you do. Concentrate your stomach acid to as much as possible. How do you concentrate your stomach acid? Fasting must be there. Salt is very important in raising your in production of HCl in the stomach. So use, as you drink your water, add in a pinch of salt. Remember, this yeast infection can also cause you infertility, and salt can also increase your chances of getting fertile. So salt is important in fertility. So use salt. Whether table salt, whether Himalayan salt, whether Celtic salt, whether sea salt, enjoy salt. Sugar is the enemy, salt is not the enemy. Now there's something called pre and probiotics, the bacteria and the food for that bacteria. That product over there is called the fermented cabbage. I keep on mentioning it all the time. The fermented cabbage is very important as a pre and probiotic. It has all the microorganisms that your body needs, and it has the foods for these microorganisms. And then it has lactic acid that will actually boost your immunity in general. It has most of the nutrients, vitamin K, vitamin C, which is important in immune boosting. Imagine combining that with fatty meats, or cooking your foods in saturated fats, the ghee, the tallow, the butter, the coconut oil, which will give you high content of cholesterol that will help you synthesize immune cells and synthesize vitamin D that also boosts your immunity. Imagine that. So fatty meats and healthy keto is part of this. Eat the meats, all animal protein, enjoy them, whether white or red. Eat them in plenty. Eat green leafy vegetables, cruciferous vegetables, cauliflower, broccolis. Basically, do all vegetables. Just make them organic. Another one that is a highly potent immune booster, do all spices. Just make them organic. You can do nuts here and there, but do not over snack. Don't snack all the time. Because snacking, the body does not understand snacking. The body knows you've eaten. Okay, so once you drop the courses, you start concentrating your stomach acid. Once you concentrate your stomach acid, you are getting over what you already had already. Now you're actually clearing your system. And fasting is very key in this, because fasting will actually, number one, deprive the yeast infection of food. Number two, fasting boosts your immunity. Number three, fasting heals inflammation. So the itching that is there starts to disappear. So embrace fasting, both intermittent fasting and prolonged periodic fasting. So you can do a 16-8, the easiest intermittent fast. You eat your first meal of the day at noon, and then you take 6 to 8 hours in between. You eat your second meal at 6:30 to 8:30. Then sleep at 10. By 10, you're in bed. Develop those habits. And then now you do some other things that are supplementary, like don't wash your panties and line and air them in the bathroom. Air them on the hanging line outside. Okay. SC254, thank you so much for this super chat. Esther, you've been much of a blessing to this channel. We shout you up 1,000 shillings for from Esther as a super chat. I mean, thank you so much for that. That means our message is sinking. Good. Stay away from yogurt and pineapples. Ladies, pineapples and yogurt will never clean your vagina. It will make it worse. That one I can assure you. Good. And then hidden sugars, the cakes, the pancakes, the biscuits. These are hidden sugars that will actually mess your system. So stay away from them. Okay? If you are overweight, start losing weight, because fat is highly estrogenic. So that will mean it will lower your immunity. If you're on any hormonal contraceptive, unless it's the injection, if you have that injection, then that you have to clear it. But if you have an implant, if you are on the pills, it is time to let them go. It's time to run away from those pills, because they'll mess you up big time. So run away from those pills. If you're those people who have OCD, you want to clean your vagina so that it smells nice for you, don't even think about that. The vagina is a self-cleansing organ, just like your ears, they clean themselves. So you can only assist by washing with clean water. Don't use soap, don't use perfumes, don't use vaginal douches, don't use tampons, don't use, what else do they use? Ladies do a lot of things to clean their vaginas, which is just a waste of time. For a self-cleansing organ, you don't need to use anything. The vagina can take care of itself. Okay, so let's see who has something for us here. If there's a question, you can post it there so I can answer, I can respond to it, and then we move. Anne Mwangi, I shower 2 times a day but have bad smell down there. I take antibiotics in Aisha Ikirudi. Yes, it will keep on going and coming back. Why is it going and coming back? Because one, even if you take a shower 4 times a day, you have not edited what causes the smell. The smell is not coming from you not showering. It's coming from what you've been eating. You are what you eat. Anything that you're taking in is actually the one that is messing you. You're taking in sugar, you're taking in seed oils, you're taking in processed sodas, processed foods, restaurant foods. So you're consuming so much unhealthy foods, and you're exposing yourself to yeast infection and even urinary tract infection. Now, again, most of you're not taught hygiene, because mothers have become so cautious, they don't talk to their daughters about hygiene. So unless you find that hygiene here online, nobody teaches you this. Just the same way sons are now finding father figures online, because their fathers have run away. So this is the point. Don't wipe yourself from back to front. Do it from front to back. Because remember, at the back, we have microorganisms. And worst of it, the most are bacteria. So when you wipe from back to front, you are introducing bacteria into your vaginal canal. Number two, who are you having sex with? Are you screening them? Are you having multiple sex partners? How do you expect to survive if you're not doing that, if you're not screening these people? So how is your diet? How is your sex life? Are you on hormonal contraceptives? Do you have any other underlying condition? Most people will go and take a diabetes test, a sugar test in the blood, and it's normal, and you think you're not diabetic. That's true, but you're pre-diabetic because your body cells are filling with sugar slow by slow, and it's just a disaster waiting to happen. How is your carbohydrates consumption? Remember, we don't need carbohydrates in our diets. So how is your consumption of carbohydrates? If it's high, start lowering it down. Change from the simple to complex carbohydrates, the beans, the butternuts, the arrowroots, the green bananas, the sweet potatoes, and what else? And the pumpkins. Use that as your carbohydrate sources because they release energy slowly into the system and is controlled. So you don't need a spike in insulin. Okay. Now, some of the mistakes that you people do: you allow every man to lick your vagina. Well, saliva has more bacteria than the mouth of the toilet, the sit-on toilet. So don't allow every Tom, Dick, and Harry to pour their bacteria onto your vagina just because you want the excitement of being licked. Don't. When it gets worse, you can get help from a medical practitioner or from a hospital or from a pharmacist. Antifungals can be given over the counter, those for insertion. Now, mistakes that people do. I've seen women swallowing those vaginal pills, the insertion pills, because the pharmacist did not explain to you the appropriate way to use it. Pessaries are for insertion into your vagina. They are not for swallowing, they are for insertion. Your doctor just says, weka hii huko chini, weka hii huko chini. Chini wapi? Chini ya kitanda ama chini ya mattress wapi? Explain to these people as laymen that hizi tembe unaingiza katika sehemu yako ya uzazi ama sehemu ya kukojoa. Just insert it into your vagina and show them the technique. That tablet is very fragile. So fungua hiyo pack pole pole, chukua hiyo tembe, weka kwa hiyo inserter. Your applicator inakaa hivyo. The applicator has a one side that looks like the tablet. That's the side that you insert that tablet. And then be hygienic when you're doing this. Apply hygienic techniques. When you insert it, press that knob. Women know these things, but you need to be trained about that. So it has to be a very hygienic and a very informed technique so that you don't reintroduce other infections in your vagina. And then once you do that, after you've done that, when you pull that applicator out, wash it with warm water so that, or even hot water so that you can sanitize it. And then air dry it so that you can use it the following day at night. Yeast infection is not a deadly infection. It can disappear, but it's stubborn because it's recurrent and it will affect your sex life. Some of you will be left because of yeast infections. Not every man will understand that this is a yeast infection. They don't even have this information, for heaven's sake. They think once you're married, you're supposed to be. And the weird part is the same man can be cheating, but he'll still blame you for having that infection. So be cautious. So if you're pregnant, don't use oral antifungals because they can affect the growth of your child. You can go for the inserts. You can practice proper hygiene. Okay? Don't be lazy. Eat healthy foods and start fasting. Pregnant women should fast. Intermittent fasting is good for you. Then don't use any antibiotic or antiseptic wipes. Every time you're using a wipe that is perfumed and is an antiseptic, has alcohol, so you're wiping your vagina. Don't do that. Don't do that. Doc, is kefir okay? Yes, kefir is very okay. Same to Greek yogurt, but unfortunately nowadays Greek yogurt, every company is using that word to just lure you into buying their products. That's a criminal offense. How to heal tooth abscess? Drop sugar, and we cannot talk about tooth abscess on a urinary tract infection live. I always do fasting thrice per week. How do you do fasting, Halima? I would like to understand how you do this fasting. Let's continue with this. Doc, what causes itchy rashes? Sorry. Doc, what causes itchy rashes, especially on face? Because Before menstruation, I tried checking via what I eat. Also went to hospital, but meds ain't helping. There's no medication that can help you reverse estrogen dominance. This is basically because of high estrogen in your system. So you need to keep fasting. You need to eat healthy, drop those carbohydrates, drop those processed foods, drop the sugars. Don't be that person who tries healthy eating for one day, and then when this condition you run to my inbox telling me, Doctor, I've tried this, but it's not working. Don't be that person. Be that person who is consistent, because for this kind of conditions, even for healthy eating, it's not easy. Healthy foods are very limited, so it's not easy. It's only easy when you're having options to cook. But it's not easy when you have friends around. It's not easy when you're that person who leaves for the weekend. You want to take alcohol. Right now, people are eating so much seed oils because it's a celebratory mood. Still, so you can imagine the types of conditions that we'll be handling in January and February. So you need somebody to remind you constantly, and also you need a group of people that will push you. Don't If you're trying to fast and you have friends who are leaving for the weekend, you will fail terribly, because if four of your friends are fat, you're the fifth. There's no way you can have four friends who are diabetic and you're not diabetic. It's not possible. They will influence what you do. So be that person who is disciplined and consistent, regardless of your friends. How to heal? Can a man get these infections or even UTI without having a sexual intercourse? Good question. Who is this? Munira, this is a good question. Now, for urinary tract infection, men can get it also. They can even get the fungal infection also. I told you, fungal infection loves filthy environments in your armpits, okay, at your gonads area, in the groin area, and men who don't practice hygiene definitely will get it. But for the yeast infection, men can act as carriers. It doesn't affect them as much. They'll just have a little itch and then it disappears. But they'll pass it on to another woman. That's the point, okay? So for men, it's difficult for them to be affected by this. But for the urinary tract infection, they can get it because the factors are so many. And most men are still eating unhealthy diets. They are not hygienic as such. So yes, it can happen. You said saliva has bacteria. What about the kisses? All of us enjoy kisses, I think so. Most people enjoy kissing. And our systems have mechanisms to fight these things. Remember also saliva has enzymes. It's a super fluid. Has enzymes, has immune cells, has uh, digestive agents, it has mucus, it has water, it has all these issues. And that's why when you bite yourself on the cheek or on the tongue, you heal so fast, because saliva also has things that act as morphines. They are actually potent than morphine. Painkillers that are so potent, and also it has immune cells. So that's why you can also connect when you're kissing, because it's all about the dopamine. And that's okay. But imagine kissing somebody with all that bacteria in the mouth, and then you're kissing somebody with the immune system being low. Definitely you'll get an exposure. And again, your mouth is not the same as your vagina, because remember, the vagina is a very sensitive organ. And the mouth, literally most of the things go through the mouth. So it has its ways of adapting. Okay? So they are different. Hello, doc. How do I start fasting while breastfeeding? You should have started fasting before even getting pregnant. Okay? But the point is this, just move your first meal from that morning breakfast all the way to midday. It's that simple. And then your next meal comes in the evening at 6:30 to 8:30. Don't eat in between. Now remember this, breast milk is not coming from the food that is in your stomach. Even energy does not come from the food that is in your stomach, because this food has to be broken down, processed, and then absorbed, then taken to the liver, stored, and then now it's burned to give you either the breast milk or the energy. So this has to take about 8 to 12 hours. So don't ever lie to yourself that what you've just drunk, not unless you've drunk sugar, salt, or water. That's what is absorbed so fast. Don't lie to yourself that what you've just eaten is the one that's going to give you breast milk. It's not. There's no tube that connects the stomach to the breast, to the nipple. There's not like that. It has to go through a process. So breast milk is coming from those fat globules and the nodules that are around the teeth, the areola area, the dark area around the nipple. So before the food that you've eaten gets there, and I've seen women who have given birth being given those energy drinks and stuff, is a waste of your time because this food has to be processed the same way all other foods have to be processed, and then energy comes from the mitochondria. So this food has to go all the way into the mitochondria. And I think if I do this live tomorrow, I can talk about the Krebs cycle so that you understand how all these foods are broken down to give you energy later on and what happens exactly. So we can do a live tomorrow and talk about the Krebs cycle and energy production. So you can actually start Elisheba Wanjira. You can actually start by eating healthy keto. Reduce the amount of carbohydrates that you're eating. Throw away sugar. Throw away wheat products. Throw away fruits, except avocado. Change your cooking oil to ghee. Then once you've adapted that, now you can push your first meal to noon and your last meal at 6:30 to 8:30. That is intermittent fasting. That is enough. You need that to enjoy your breastfeeding. Keep up the good work, Doc. Fasting. Tom Wanjala, I celebrate you, bro. You're somebody who was actually, hey, I've seen a transformation in this gentleman. Don't even think about it. You can follow him and see what he does. Uh, Good work, dog fasting. Change that. Worked magic for me. I am now 86 kgs from 109 kgs. This was like a bodybuilder. My brother, the gentleman was a bodybuilder, was a beast. And you look at him and you want to run away because you're so scared. Now he's getting lean and lean and lean, and all those abs are coming out, bro. Such an important transformation. And men know a lean man is a dangerous man. Women even know that better. Uh, Eda Chepngetich, I had UTI immediately I conceived. I saw a doctor and I was given safe antibiotics. Fast forward, my daughter turned out to be autistic. I have always suspected the antibiotics I was given then. Now, this is a sad story, right? Oh, we can't help but feel sorry for you. However, we empathize. We don't sympathize with you. We empathize with you. And the reality is this: just change the diet of your child and see how they recover from this. Take your child on a zero carbohydrate diet, zero sugars, zero carbohydrate, zero seed oils. Just that. Don't push your child into fasting. Just give your child meats and animal meats, animal protein, meat, fish, chicken, the liver, eggs in plenty. Don't give them milk. Actually, I was almost forgetting this. The carbohydrate that is in milk, the sugar that is in milk is actually appreciated and loved by yeast infection. So if you keep on sucking that packet of milk hoping that it has calcium and it has the protein, it is zero nutritional value. Milk is for babies and calves. Let it go. Yeast infection appreciates, loves the sugar that is in milk. Milk sugar is dangerous if you're having a yeast infection. Drop it. So yeah, don't give your child. How old is your child actually? Just feed your child with healthy foods: mashed beans, mashed sweet potatoes, water, salt, animal protein, fish, chicken, eggs, the liver, red meats, fatty meats. Cook their food with ghee and butter. Look at how this child starts to rejuvenate their brain and their nerves. You'll be amused. And this also happens to epileptic people. Change your diet. Monday, Wednesday, and Friday are my fasting days. Awesome. That's a good one. But you can do fasting every day, intermittent fasting, okay? I like shaving everything down there. Is it okay? There's no harm in shaving as long as you're doing it the right way. Don't shave against the hair because you'll get those pimples. And don't use those creams that the shaving creams. Don't use them. They will hurt your organs. You can actually reduce the amount of hair, okay? Don't also shave too much because we know you're not shaving it for yourself. Don't let that gentleman give you too much pressure. Annie, yeah, don't let that gentleman give you too much pressure. Thank you, Doc. Please advise on feeling tired and all the time and waking up tired. I am around 65 kgs. Waking up tired is multifactorial. You can either be suffering from a condition, possibly diabetes. I want you to do a HbA1c test, and you can also do a C-peptide test to see how your blood sugars and your insulin are behaving. That is one, because tiredness is actually linked to insulin. And then regarding this topic, I don't want to drift away so much. I think we can have another conversation using my contacts that I'll give. So my contacts are actually, let me just give you that contact so that uh, there goes my contact. So if you have any issue you want to raise, you can easily raise it. Let me pin it. You can easily raise it using that contact. Somebody will pick that call and talk to you. Don't be too stubborn. Just go ahead and say what you want. They will talk to you, and yeah, we will get to fix what is going on. You will possibly you will pay. I will not lie to you. So yeah, you can book your appointments through that number. You can also have one-on-one with us when you are allowed to. But on these lives, you can always ask that question. I can easily respond. What causes bad breath? Sugar. Derek, you're saying good evening to us. Are you late here? So as we wind up, tomorrow we can have a live, possibly. If not tomorrow, the other day, the following day, so that we can talk about how we break down energy, carbohydrates, protein, fats. How do we break them down? How do we tell you that fruits are not, when it gets into the stomach does not understand that it's a fruit, knows this is fructose. How does the liver differentiate? Is there natural and synthetic sugar? Where do they go after being broken down and absorbed? Where do they head to? Where is energy coming from? Is it coming from the stomach? Why do we feel energetic after we've eaten a meal, yet we were feeling so low? Why is sugar the major enemy? So we'll talk about these things on a detailed platform that basically we'll be talking about something called the Krebs cycle. It will be awesome. It will be awesome. So yeah, why do men suffer from HPV more than women? Why is it hard to disappear immediately? Now listen, HPV from the word V is a virus. In viral conditions, when they get in the body, it's hard for them to live. But you can suppress them by boosting immunity. We don't want to go into the reason why men get more HPV than women. We don't want that. We want to focus on how to reverse it once it's here. So don't focus on studies, because studies are the ones that will tell you, hey, women get more this than that. Women get more thyroid conditions than men. But reality is, when women are the ones who get scared when they start adding too much weight or losing weight, when they have these fevers. They're the ones who rush to the hospital to go and take a thyroid function test, and they'll basically be diagnosed of low thyroid or high thyroid. But it doesn't mean that men don't have it. They do have it, but the chances of men going to hospital just because they have a fever, that's small. Good. I think we are good here. Time to summarize. Thank you so much for joining us. We've done an hour of this. We'll be doing an hour of each. Thank you so much for being active audience. We appreciate you. And as usual, this is the Health and Wellness Spot. If I've not answered your question today, we definitely will answer it on another platform. You can join my Telegram channel. It's called Health and Wellness Sport. Be there, be active. Let's kick 2024 in style. Let's ask those questions. Let's question those systems. Share your research there. Let's read it. Let's enjoy it. And let's build each other every other time. This is your favorite doctor, always at your service. You can use that number to book your appointments. You can also, don't forget to subscribe. This channel is Health and Wellness Sport. We are going to hit 100,000 subscribers very soon. But the case is, we are not interested so much in the subscription. We're interested in you watching the videos and learning from it, because we don't exist for the subscriptions. We exist for the impact. Our existence is to just narrow that gap between you and healthcare, to help you make sound decisions, and also to impact your lifestyle so that you change. It's an holistic approach. We talk about spiritual issues, we talk about mental issues, we talk about physical stuff, and you realize 80% of these things that we talk about is basically the physical, but the physical is just a carry of the spiritual. So we started focusing also on the spiritual and the mental, so that we create a holistic approach of healthcare. And thank you so much for being an amazing audience. Thank you so much for subscribing to our channel. We will never disappoint you, because we were born to do this. Have a good night, and let's see each other when we can.